How does one reduce the risk of passing diabetes to the next generation? This is one of the things which will be scary for the parents, especially about their kids. So genetics, as I told earlier, was just one of the risk factors for diabetes. Along with that, as I told earlier, environmental trigger is a must to cause diabetes. So earlier I given an example of an identical twin about it. So lifestyle plays a major role in people suffering from diabetes. Making lifestyle choices help people to reduce the risk of diabetes, particularly type 2 diabetes. What are the lifestyle changes which can help? Like maintaining a healthy body weight of BMI ideally around 23 kgs per square meter, being physically active in the form of minimum of 30 minutes of brisk exercise 5 days a week, and eating healthy balanced meals, especially low fat, low carbohydrate diet with lot of green leafy vegetables, what we call it as Mediterranean diet, with low salt, low dairy products and low meat, red meat especially. And active lifestyle, reducing the stress also plays an important role in the onset of diabetes. Importance of lifestyle modification in diabetes. What are the lifestyle modifications? What are the daily routine for managing diabetes effectively? Eating a balanced meal such as fresh fruits and vegetables, whole grains and low fat containing foods. Eating right proportion of healthy foods. Eat foods that have less salt and fat content. Get at least 30 minutes of activity or exercise on most of the days of the week. Replace refined carbohydrates with whole grain foods and increase intake of vegetables and foods with high dietary fibers. Choose calorie-free liquids such as unsweetened tea, coffee or water. Choose sugar substitutes and consult a dietitian for an individualized dietary plan. What are the dietary modification in diabetes? As I told, most important is eat healthy. This is crucial when you have diabetes, because you eat whatever you eat affects your blood sugar level. No foods are strictly half limits. Focusing on eating only as much as your body needs should be the goal in diabetes. I'll be dealing with three aspects of diabetes. And when you come to the diabetes, when we are dealing with the patient, most commonly asked question is diabetes a familial disease? Lot of people start asking about it. Definitely diabetes is a complex set of disorder characterized by persistent hyperglycemia. There are two forms of diabetes, type 1 diabetes and type 2 diabetes. Both of them are caused by combination of genetic and environmental risk factors. However, there are other rare forms of genetic diseases which are directly inherited. They are maturity onset diabetes mellitus in young and diabetes due to mutation in the mitochondrial DNA. Genetic factors make people vulnerable to diabetes, but the genetic cause for diabetes is also affected by diet, lifestyle and environment. You inherit a predisposition to the disease, then there should be some environmental trigger to cause diabetes. So genes alone are not enough for diabetes. One proof is study in identical twins who have identical genes. One twin with type 1 diabetes, the other gets the disease only at 50% risk. When one twin has type 2 diabetes, the other risk is mostly 3 in 4.